Welcome to Kenton Teaches. Enjoy the video.
You begin by verifying the order and obtaining informed consent. Confirm patient ID and any contraindications. Next, set the machine to the correct exam preset and select K, VP, and M as ranges based on body part and patient size. Position the detector and patient precisely. Make sure the detector is locked and source-to-image distance is set. Once done, apply lead shielding to areas not imaged and explain breath hold or positioning cues so the patient knows what to expect. With the patient positioned, frame the anatomy and align the central ray. Place anatomical markers for later review. Decide between AEC and manual technique. If using manual, adjust KVP/M as for tissue thickness and use a grid for thickness above about 10 cm. Check alignment with the light field or lasers and reconfirm immobilization. Once ready, give a clear countdown, request any breath holds, and make the exposure while monitoring for motion and proper collimation to minimize repeats. After acquisition, immediately evaluate the image for exposure, positioning, rotation, and artifacts. If diagnostic quality is met, label and send to PACS. If a repeat is needed, document the reason and change technique deliberately. Adjust KVP or M as reposition the patient or correct centering. Verify detector and cables if strange noise or artifacts appear. If persistent, switch to an alternate detector or consult service. One troubleshooting tip. If repeated underexposure occurs, check AEC chamber placement and backup exposure settings before further repeats.
Thanks for watching. Please subscribe if this video was helpful.